Welcome to the Hill's Bang for Your Buck, Get the Most from your 2026 Medicare Drug Benefits event. As the government shutdown stretches on, uncertainty is rippling through agencies, budgets, and the millions of Americans who depend on federal health programs. With major changes to Medicare prescription drug benefits slated for 2026, the timing couldn't be more critical. What do beneficiaries need to know for Medicare open enrollment, which is already underway, running October 15th through December 7th? To kick off our event, please welcome Bill Salmon, SVP of Editorial Content at The Hill.
Good morning. Thank you. It's easy to understand why there is so much uncertainty, and not just among the people who are inside our federal health agencies writing up budgets for next year, but also uncertainty among the millions of Americans who are relying on these federal programs in their daily lives. So the timing today really couldn't be more critical as we grapple with a number of very pressing questions, including the following. What do beneficiaries need to know about Medicare open enrollment, which, as I mentioned, is already underway? Is the Medicare prescription payment plan actually helping those who need it most? Will selected medications be available at community pharmacies? How can you be sure you're getting the most out of your drug plan benefits? And finally, how can beneficiaries and advocates shape the next round of negotiations? Well, we hope to get some answers to these and other questions today in our program. We also hope that everyone will follow along the conversation on social media using the hashtag #TheHillHealth. Let me repeat that, hashtag #TheHillHealth. With that, I want to take a moment to thank our sponsor, the Alliance for Aging Research, for their generous support in making today's program possible. In fact, we will now begin the program with a short video from, again, the Alliance for Aging Research. Thank you so much for coming out today.
Medicare Part D is an optional benefit that helps cover the cost of prescription drugs. To help beneficiaries better afford their medications, there is an annual limit on Part D plan out-of-pocket costs. In 2026, it will be $2,100. Having an annual limit is helpful, but it can still be a lot of money to pay. Fortunately, another benefit called the Medicare Prescription Payment Plan helps beneficiaries spread their out-of-pocket costs into monthly installments with no interest or fees. It doesn't cost anything to sign up or use this payment option. However, you must sign up with your Part D insurance plan at least 24 hours before you pick up your prescription. You can't sign up for it at the pharmacy counter. If you switch Part D plans, you will need to re-enroll in the payment plan. You can sign up at any time, including during open enrollment. Once you decide to participate, you won't pay anything when you pick up your prescription. Instead, you'll be billed later by your Part D plan and will pay in interest-free monthly installments. Talk to your Medicare Part D insurance plan provider to learn more and visit www.loweroutofpocketcosts.org.
Now, please welcome Sarah Cott, SVP of Programming at The Hill, in conversation with Adina Lasser, Director of Public Policy at the Alliance for Aging Research.
Good morning, Adina, and thank you for joining us today.
Thank you so much for having me, and thank you to The Hill for partnering with us on this important event.
So let's start with the very pressing issue of Supplemental Nutrition Assistance Program, or SNAP. The Alliance has been very active in advocating for SNAP. We touched on it on the last event that we did together. So before we get started, we wanted to follow up on that.
Yeah, it's a really timely question, and as Bill mentioned, it's something that is at the top of all of our minds. Right now, we are facing a dire public health emergency. 7 million older adults struggle with food insecurity, and SNAP is our best tool for making sure that we're fighting hunger and malnutrition. And it's not just older adults. 1 in 8 Americans benefit from SNAP every month. And what we want is, what we want ultimately is for the federal government to reopen. But we're aware that we're facing an immediate emergency, and people should be able to rely on the benefits that they've been promised. And so we're calling on Secretary Brooke Rollins, the Secretary of Agriculture, to tap into a contingency fund, which is worth $5 billion, to continue funding SNAP benefits into November.
Thank you so much. It is now open enrollment period for seniors and those with disabilities. The Alliance recommends that both current and new Medicare beneficiaries pay special attention to reviewing their Part D drug plan offering during open enrollment. What changes should beneficiaries be aware of?
The first thing that I want to make really clear is that this is the year of any year to shop around. Beneficiaries in Medicare will often choose a plan and stay on that plan for the rest of their lives. Every year, it costs you money to not be doing an active comparison. But this year, especially because there are so many changes coming to the program, it's a year to take a look at it. The first thing that I want to touch on are premiums. Premiums overall, we're seeing a bunch of headlines that premiums are staying the same or going down. But the Kaiser Family Foundation found that as premiums on individual plans might be going up by as much as $50 a month. So just because on average they're going down, that doesn't mean that your plan is going down. So the takeaway is check your plan and compare to other plans in your area. Another thing to be aware of is that there is a $2,100 cap on out-of-pocket expenses for all Medicare beneficiaries. This is automatic, you don't need to enroll in it, and it's a huge change over what existed before, which there was no cap at all. Last year there was a $2,000 cap, and before that there was no cap at all. But that's still a lot of money for most people. And so one thing that we're really emphasizing to take a look at is to make sure that you're looking at how are your drugs being covered with utilization management? Is your formulary changing? Are they in a less preferred tier, meaning that you're going to have more cost sharing? And we're also calling on CMS to be more transparent with that information because it's a little bit hard to find. And so overall, the bottom line is even if you're happy with your current plan, it's worth comparing because small changes in your pharmacy network or your deductible can make a big difference to the costs that you pay.
Thank you. So there's a lot of information and changes that people need to address. So where is a good source for reliable information?
It's a great question. The first place that I want to point everyone is the state health insurance assistance programs. We're actually going to hear from a SHIP expert in Maryland later in the panel, but they are free, they are unbiased, they're run out of your local area aging agency, and they'll give you one-on-one advice about which plan is best for you. They're a really incredible resource, and they're in every state. The next is the Medicare.gov Plan Finder. You can go to Medicare.gov and compare how much does your drug cost at your pharmacy on all of the varying plans. And then, of course, there's trusted nonprofit partners like the Alliance for Aging Research. We have been doing a lot of work, like the video that you saw earlier, to get the word out about what, and of course this event, to get the word out about what changes are coming in 2026 and what we can do. And so we also have a number of partners that we work with, such as the National Health Council and MapRx and the PAN Foundation, who have incredible tools. And so we've compiled all of those resources at loweroutofpocketcosts.org, and I encourage everyone to check that out.
All right, thank you. That's a great website for everyone here to remember. Can you tell us a little bit more about the Medicare prescription payment plan and how that can help beneficiaries with cost?
Yeah, so as the video showed, the Medicare prescription payment plan allows beneficiaries, especially beneficiaries who have that higher deductible or who are meeting that $2,100 out-of-pocket limit early in the year, to spread out their costs over the course of the year in monthly installments that are interest-free. So it's a huge tool for helping to make sure that you're not seeing those costs right at the beginning of the year and having to face them. Like the video said, it's important to make sure that you opt into it. You have to opt in. You can't just assume that you're on it. And you can't pick up your drugs at the pharmacy counter within 24 hours of enrolling. You have to wait that 24 hours.
Thank you. This is all very great and good information.
Yeah.
So let's turn our attention to Medicare negotiated drug prices that will go into effect in 2026. There is great concern among independent and community pharmacies about the financial strain this new policy will cause. Could you talk about why community and independent pharmacies are raising the alarms and how this could impact beneficiaries and their access to essential medication?
Yeah, so as you mentioned, this is the first year that Medicare can negotiate the cost of 10 prescription drugs. And independent pharmacies are raising the alarm because the way that these prices have been negotiated, essentially, they're not getting reimbursed as much as it costs to fill a prescription. And so they're saying, they're small businesses, they're independent, they're in the community. And this is a huge concern for older adults and for Medicare beneficiaries overall because your pharmacist is often the first-line provider that you see, and they're the person that you're asking questions to about your drugs. And so definitely something that we want to be aware of. The National Community Pharmacists Association found that as many as 93% of local and independent pharmacies might not cover at least one of the 10 negotiated drugs. So a huge concern. Another reason to check and make sure that your drug is being covered at your pharmacy, and we're calling on CMS to fix this issue.
Dina, thank you so much for this very informative conversation.
Thank you for having me, and thank you to The Hill, and just another reminder for loweroutofpocketcosts.org.
Thank you, guys.
Thank you.